Hello everyone, I'm Dr. Ranjan Upadhyay and I work as a consultant dermatologist and hair transplant surgeon at Desmodum Skin and Laser Clinic. It's in Vasant Kunj, New Delhi, and I'm also a consultant dermatology and hair-related disorders and hair transplants at Max Panchsheel in Saket. So today, I think we'll be discussing something in short, something about hair transplant surgery, like who is ideally eligible, what is actually hair transplant surgery, and who is an ideal candidate for getting a hair transplant surgery, and what you can expect out of it. So basically, everybody wants to know what is exactly hair transplantation. So before that, let me tell you, there are various grades of hair loss that we have ideally divided for ease of understanding what is the grade actually, so that we can actually design a customized treatment approach for that. So grading of hair loss is actually, we call it Norwood-Hamilton classification. It ranges from grade 1 to grade 7, wherein grade 1 is the lowest amount of hair loss and grade 7 is the highest amount of hair loss, which is almost equal to complete balding, except for the recipient donor area, except for the back portion which is the permanent zone. So who is ideally, so what do we actually do in hair transplantation? Hair transplantation, what we do is we actually take the hair follicle from a donor area. Donor area is the area where you have a lot of hair follicles, especially in the occipital area. This is the posterior portion. This is the permanent zone where we have hair follicles. And then we transplant it into the recipient or the area where you have less hair follicles. Ideally, it is on the frontal area of the scalp. Now, the latest techniques these days are follicular unit transplantation techniques, wherein each of the follicle is implanted into the donor area. The two major techniques are the strip harvesting, wherein a strip of hair follicles is cut from the posterior portion and then the hair follicle are individually transported into the frontal area. Obviously, this requires stitching, but the latest and a less aggressive technique is the follicular unit extraction technique, in which individual follicles are punched out from the back portion of the follicle of the hair, and then they are transported into the recipient area, primarily the frontal area where there is the balding. So this is about hair transplantation. Now, normally patients ask, who is an ideal candidate? Like, am I an eligible candidate for the hair transplantation? So ideally, there are certain criteria for choosing an ideal candidate for hair transplantation. Like a person has to be ideally between 25 to 65 age group bracket he should be in. Then it depends on the severity of the hair loss. Ideally, if a patient has crossed grade 4 or grade 5, he is an ideally suited candidate for hair transplantation. Then we also have to consider the other medical profile of the patient, like he has to be medical if there's any other concerns like any comorbid conditions like uncontrolled diabetes, blood pressure, hypertension, bleeding disorders, etc., etc. We also have to consider all those things and take the patient and for the surgery only after the consent of their treating physician. Now it also depends on the the type of hair loss which is there. So hair transplant surgery is ideally suited for male pattern baldness or the female pattern baldness, ideally pattern baldness. The other forms of hair loss, generally it is not a very preferred technique. So these are some general criteria which we have to take into account before choosing the eligibility of the patient. So hair transplantation, in short, I would say is a technique which is ideally suited for pattern hair loss. The age group, bracket for the ideal candidate should be maybe 25 to 45 years of age group. The better suited techniques is follicular unit extraction, which is less invasive, no scarring, minimal downtime, and the patients are quite comfortable with the technique. And I would suggest patients who fit in the criteria to go for the hair transplantation without any form of hesitations. And you must select and meet your expert, the hair transplant surgeon, and discuss your case for a customized approach for your particular case. As the hair growth in your case will actually make you more acceptable. It will help to build up your own self-esteem. So this is a very safe and very advised technique for patients who have got advanced pattern of hair loss. Any further queries, you are free to talk to me or message me or anybody for that matter from the team. So that was some short introduction about hair transplantation. Take care. Thank you.